Welcome everyone. This presentation will cover the pre-vaccination health check following the Electronic Vaccine Data System, or the EVDS, showing how to use the PAC vaccine job aid alongside this. Included in the session is a more in-depth allergy risk assessment. Please note that this presentation uses the latest version of the job aid, which was updated on the 24th of May. This version can be found on the following websites, either the PDC training website or the KTU Vaccine Resources website. These websites will be listed at the end of this presentation. You will note that version 2 has an additional box on the front cover with a summary of any recent changes within the job aid. Furthermore, to make it easy to see where the changes have occurred, a stamp has been added to the pages that have been updated, and the content that has been updated is now highlighted. The date is listed in the top right-hand corner as well to help you keep track of the latest versions. Where do you find the pre-vaccination health check and the allergy risk assessment? The contents page of the job aid directs you to page 5 and 6. Let's turn there now. This is page 5 of the job aid, and at a glimpse you can see it's been recently updated. Let's take a closer look at these stamps at the top of the page. The update stamp is showing you that the steps have been reordered. The steps now align with the order in the EVDS. Then there is a small reminder stamp about handling anxious clients. Many people arrive nervous as they've been exposed to misinformation in the community. Anxiety increases emotional responses, causing muscles to tense, increasing perception of pain, and ultimately may contribute to vasovagal faints. The pre-vaccination health check allows the vaccinator a small but useful opportunity to be kind and reassuring and help clients to relax. The last stamp at the top emphasizes that there are very few reasons why one would not vaccinate a client. The only absolute contraindication to vaccination is a history of immediate allergic reaction after a previous COVID vaccine or a known allergy to an ingredient known to be in the vaccine. We'll go into more allergy detail in a moment. The steps on this page help you assess and navigate the precautions. Before you start with the pre-checks, remember to check everyone is wearing the correct PPE. You should be wearing a surgical mask which covers your nose and chin. Make sure your client is also correctly masked. Aprons, gowns and gloves are not necessary during vaccination. However, if a client discloses that he or she is HIV positive, then it is advisable to wear gloves during the vaccination procedure. Note that the client will have been screened for acute illness or COVID infection upon entering the vaccination site. Step 1 instructs you to work through the steps on the EVDS. This requires that you confirm the client's ID and go through the medical questions and obtain consent. A note here informs you that steps 2 to 6 in the job aid will help you to decide if any action is needed according to the client's responses to these questions. Let's take a look at what you'll see on the EVDS. You will see red stars as you go through the EVDS. These indicate compulsory fields that have to be completed in order to proceed. Start by searching for the correct client using their ID number. You will then need to select the correct client from a list that appears below. Next, confirm that the client's details are correct. Click the box to indicate that you have done this, and then click Confirm Patient Details. A new window will appear that allows you to update or correct any details if needed. Importantly, use this opportunity to fill in the client's medical aid and their medical aid number if applicable. Select None at the top if they do not have a medical aid. Once you have confirmed all the other details, you can click on the Update Patient button to proceed. This will close the window. Next, you will need to click the Register Vaccination button to continue. There is a function at the top that allows you to back capture a vaccination by inserting the date and time of that vaccination. Only use this in the event of load shedding or a similar situation. It will automatically show the date and time now, so usually you can leave it as it is and move straight to the section called Obtain Health Background. You will see a list of medical questions that you will need to go through with the client, clicking yes or no according to their responses. It is this list of medical questions that the PAC Vaccine Job Aid provides additional support with. It will help decide whether you, as the vaccinator, wishes to proceed with the vaccination today. Following the questions in the EVDS, you will need to ask the client the questions and use the job aid to guide actions in response to the client's answer. So here, for example, if the client has had a vaccine in the last 2 weeks, you should advise them to return at least 2 weeks after their last vaccination. For previous Comirnaty COVID vaccines, the doses need to be at least 21 days apart. Note, the client should have been screened for acute illness and COVID symptoms at the entrance, and so the answer to the first question should be no. Similarly, for the next one, ask the client the question about recent previous COVID. If the client has had COVID within the last 90 days, the corresponding recommendation in the job aid advises that the vaccination be delayed until 3 months after testing positive. When it comes to step 3, which asks about a history of allergy, the job aid uses the same prompts as the EVDS to identify the client who requires a more in-depth allergy assessment on page 6. We'll come back to this at the end of this session. When it comes to the question about chronic medical conditions, blood clotting disorders often come up. Step 4 covers clotting disorders and those taking anticoagulant medications or blood thinners. If none, you would obviously move straight on to the next step. Some clients may have heard about the very rare blood clotting side effects that have been in the spotlight internationally with the COVID vaccines and want to know more about this. You are not required to know about this in any detail, but if asked about it, this step helps you to provide some information and allay some of the concerns the clients may have. Should you need, the footnote on this page provides a brief explanation and some advice for the client. In a client with a current or previous history of blood clotting disorder, only in the very rare instance in which the client has a history of unusual blood clots in the presence of low platelets, which are the cells that help your body to stop bleeding, would you be prompted to discuss the case with a doctor before vaccinating. Where there is no history of an unusual blood clot in the presence of low platelets, or the client is on an anticoagulant or blood thinner for another reason, you are instructed to proceed with the vaccination. There is no contraindication. A note clarifies that clients are advised not to stop medications before getting the vaccine. As a standard precaution with any intramuscular injection for a client on warfarin, there is a reminder to ensure the latest routine INR result is not above the therapeutic range, which is normally 2 to 3, unless the client is on warfarin because of a mechanical heart valve, where a higher range is acceptable. Step 5 covers chronic medical conditions requiring ongoing specialist care. Again, if none, you would move straight to the next step. If there is a prompt to reassure clients that having a chronic medical condition is not a contraindication to vaccination. It goes on to clarify that immunocompromised clients and clients with an autoimmune disease can and should still be vaccinated. It's important to emphasize ongoing prevention measures in this group to protect themselves, as there is the potential for reduced immune responses and unknown vaccine effectiveness. Clients on immunosuppressive therapy should confirm the timing of their vaccine and the dosing of their medications with their specialist. Immunosuppressive therapy may be used in various autoimmune conditions, for example methotrexate. It is also used in cancer or transplant treatment regimes. Step 6 covers the last question about pregnancy and breastfeeding. Advise the breastfeeding client that vaccination is a personal choice, but explain that as non-live vaccines pose no risk for breastfeeding mothers or their infants, COVID-19 vaccines are also not thought to be a risk. Advise the pregnant woman that data is still limited and again, vaccination is a personal choice. Explain that initial studies have found no increased risk in pregnancy complications after the vaccine, and experts advise that pregnant people should be vaccinated due to the high risk of complications from COVID. If the breastfeeding or pregnant client understands and consents, continue with the vaccination process. This brings you to the end of the medical questions on the EVDS, where it asks you if you wish to continue with the vaccination based on the client's responses. If the job aid has not indicated a delay is needed, you can click on the Yes box. If the job aid indicates that vaccination should be delayed, click on the No box, which takes you to an exit window that looks like this, where you can fill in the reason and exit without the vaccination being registered. If you answered yes to continuing with the vaccination, it will take you to the next section, which requires you to record informed consent. You will need to select the vaccine that you are giving today by clicking on the drop-down menu. This will then open up an information window relevant to that vaccine. Note that this information is different for the Comirnaty and the Janssen vaccines. You should then ideally read this information out to the client. You can then tick the box which says you have read and explained the above to the client. This will further expand to show the consent for the client. Again, you will need to read this out to the client. If the client consents to being vaccinated, tick the Yes box. If for any reason the client does not give consent, you could tick the No box, which would take you to an exit window that looks like this. Once the client consents, the system will take you to the Register the Vaccination tab. Ideally at this point, you would draw up and administer the vaccine and complete this information after it's given. You can then tick the box that confirms this. Then you will need to select the type of document you use to verify the patient's ID. The other fields should be pre-populated other than the batch number field. You can select the correct batch number from a drop-down menu. You can then click on the Register Vaccination button to complete the process. This will take you to the final confirmation screen. This is the final screen for the Janssen vaccine, where, because there is only one dose, it tells you that the course is complete. This screen is slightly different for the Comirnaty vaccine. Here's an example of where it gives you the next vaccination date for the second dose of the Comirnaty vaccine. It also confirms that an SMS will be sent to the client's cell phone with this date. You just need to click the Finish button to complete the vaccination process. It will take you back to the original search screen ready for your next client. In the meanwhile, this client can then move to the observation area. Please note that you are now done with this client. You do not need to log back into the client's profile unless the client experiences an immediate adverse reaction. Before we finish this session, let's visit the scenario where a client has a history of allergy and needs a more in-depth risk assessment. In this case, you would have been prompted to go to page 6 to do this. This is page 6, the Allergy Assessment. Let's zoom in to take a brief look at the content. It starts by explaining the symptoms of a severe allergic reaction in more detail. This way you can confirm that the client has indeed had a severe allergic reaction in the past. If after this, the client realizes that they haven't had a severe allergic reaction in the past, you would return to the previous page and continue with the rest of the questions. However, if the client has had a severe allergic reaction in the past, your first question will be if it was to a previous COVID vaccine, like the first dose of the Comirnaty vaccine. If yes, then you would not vaccinate the client, but rather refer them to an allergy specialist. If no, next you would ask if the client has had a severe allergic reaction to another vaccine or an injectable medication. If no, i.e. the client had a severe allergy to another substance like food, a pet, insect venom, latex, or an oral medication, then you would proceed with the vaccination today, but observe for symptoms post-vaccination for longer, 30 minutes instead of 15 minutes. If the client has had a severe allergic reaction to a vaccine or an injectable medication, ideally a doctor should risk assess further. The next question should be if the client has a known allergy to any of the ingredients in the COVID vaccines, listed in the table below. There is a prompt to ask specifically about the agents most commonly responsible for allergic reactions, polysorbate or PEG. If yes, or the client is unsure, you should not vaccinate today, but rather refer. If no, vaccination can proceed with a longer observation time period. That brings us to the end of the allergy assessment. We've covered a lot, so let's quickly summarize the pre-vaccination process. You will start by searching for the client using their ID and selecting the correct one from the list that appears. You will then confirm the client's details are correct and begin the vaccination registration. You will then obtain a health background by working through the medical questions and referring to the PAC vaccine job aid as needed. After this, you need to record informed consent. Then, after administration, you will register the vaccination. And lastly, you will need to finish the process. Thank you for listening to this session. Good luck, and thank you for playing your vital part in this rollout. As mentioned earlier, here are the websites where you can access the latest versions of the PAC vaccine job aid.